I was, again, almost 50 before I said the word fat. I could see the fat on me, not because my doctor said it, not because somebody told me, because I could see it on myself. And so what a benefit it would be to have your health practitioner to say, no, you're obese, right? Or you're fat, or you need to lose weight. But a lot of times you can't, right? Because we live in a world where people get offended. And so you do get offended.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. The body rarely goes from silent to crisis without warning. It whispers first: knee pain, back pain, shortness of breath, difficulty bending, or movements that suddenly require more effort. In this episode, Lisa Wiley explains how she blamed some of those changes on age and why no one clearly connected them to her weight soon enough.
I wasn't 260 and had a lot of body rolls. I was a thick,
260.
solid 260.
So you felt every bit of it.
Absolutely. You just feel heavier. You feel heavier. Didn't deal with a lot of I wasn't out of breath, right? I wore high heels. I worked my 260.
Did your knees hurt?
They started to hurt as I got older, and going up steps, I would feel it in my knee, in my left knee. It was unbelievable. And
how about back pain?
So, yes, then I can talk about the back pain, but the knee pain, I didn't even attribute it to weight. I attributed it to age.
Even though you were relatively, and you're still relatively young.
I was 50 young. Thank you.
It is. I'm almost 50, so it's young.
I thought it was age. I said 40. I'm 40, and your bones start cracking and aching a different way. I was thinking it was age, and in my mind, not saying it was weight. Because at this time, I've had a husband who loved the body that I never had people tease me, and I felt like I was called out, right? One, because I distracted people when I was younger. Then I gained weight, and I dressed, nicely. I dressed a certain way. I had this big bubbly personality, and so I think people did get to see my personality over my weight. But it's the internal battles and things that I go through in my mind with this weight. So I didn't grow up people saying, oh, you need to do a thing, you need to do a thing, you need to do a thing. So again, when my knee started hurting, I'm like, oh, I'm just getting old. No, I was fat. It was weight. That was a lot of weight that was on my body. And so that's the way I felt it. I felt it in my knees. I felt it in my back. I did. I ended up having to have back surgery.
You had back surgery?
I did. You didn't know that? Why do you keep learning these new things about me? I did. I had back surgery.
Do you think the back surgery was because of the excess weight?
I had 2 herniated discs, and they were touching a nerve that caused so much pain. And so I think between the weight and, carrying children and the work that I used to do, I think all of that attributed to the back pain. So I had surgery before COVID. Was fine. Back in my high heels, back doing the things that I needed to do. Never really got into exercise. After dancing, I never got into an exercise regimen or routine.
Did the orthopedic surgeon ask you to lose weight when you had the surgery?
He did not.
He never brought it up?
Mm-mm.
Why do you think he didn't?
I'm not sure, but he didn't. I'll tell you what he did tell me. So I had the surgery. I got much better after having the surgery. And then maybe 2020, I started having some back spasms and pains again. And he said that I could have other herniated discs because I had the surgery, had them removed, that it could cause some other disc to slip. So I started having some pain again. Went back. I had a small herniation in L3. But he's like, it's too small to do surgery. I was like, okay. He said, you need to strengthen your stomach muscles. But never told me I needed to lose weight. He said I needed to strengthen my stomach muscles. He's like, you're not doing anything. And so you have a weak stomach, abdomen. Like, you need to build that. Start working out, do some sit-ups. I promise if you strengthen that, it'll improve your back. I was like, okay.
Do you think that was his way of telling you to lose weight?
Maybe.
Now, I bring this up because when I had the episode with Stephanie, she mentioned something, and I've heard this from other patients, she's not my patient, but a lot of my patients, that they get offended that when they go see a doctor, whatever complaint they have is attributed to excess weight.
Mm-hmm.
And so it makes some doctors now reticent to talk about weight, to bring up the issue, which is really a strong contributor to the patient's problem, right? So there you were, 100 pounds overweight with back pain, 2 herniated discs, and the doctor did not bring it up.
Did not.
And do you think that was beneficial to you?
Absolutely not. I wish he had said lose weight. I wish he had said build your stomach muscles a lot sooner, because it was close to, going into COVID, sitting at my desk, having these back issues reoccurring again. Him saying build your stomach muscles. Me coming to I'm getting on blood pressure medicine. My job doing this, they wanted everybody to kind of get up and get active and get moved. All of those things happened at the same time. Here I am, 48 years old. So I absolutely wish he had said lose weight in 2004 when I had the first surgery.
So this silence is actually hurting patients. This fear of bringing up a patient's weight when it's actually the biggest health concern the patient has. Because, many times I have a patient, young patient, 28 years old, 29 years old, they're 100 pounds overweight, 150 pounds overweight, and their labs look good. And I always have to tell them, your labs look excellent, but the biggest health concern you have is that you're carrying 100 or 150 pounds of excess weight, and it's damaging your kidneys. They're like, well, doc, I can walk. I don't have a problem. And I say, it's going to hurt your back. Well, I don't have back pain. And then I have to tell them with time it will happen. How do you feel about that? Was that the case with you?
I think with time, with weight, the high heels, and no exercise, absolutely took a toll on my body. At one point, I could barely walk. I bent over to write a card and couldn't sit back up because of the weight and the back, the herniated discs. They had just gotten so out of control. But he didn't tell me to lose weight. And again, because this is the family I grew up in, I'm used to this body, weight.
You're used to everybody being big. Big boned.
Big bone, thick. Because we weren't we didn't, in the big, it looked different. Like we were not, and I don't know how to describe it. So maybe you can help me describe it. Or even if you look at some of the pictures that I had, my 260, when I look at some of these weight loss shows that come on TV and they put the little shirt on them and their biker short, and they are 300. I'm like, I'm 40 pounds behind you, and I don't look like that. So it wasn't like rolls but we were thick women. I grew up and I'm like, this is okay. So if no one told me to change it, then.
So you felt like being fat was the norm?
I felt like being a thicker woman was okay.
Okay. And I said the word fat on purpose because we have removed it from our vocabulary and replaced it with big and larger body. But here we are with an epidemic of obesity. Again, that word in the Black community almost approaching 50%. And we know that 85% of people with type 2 diabetes are overweight and or obese. And most of these people are African American or Black. We have high rates of
obesity, high
Mhm.
blood pressure. And you just mentioned your struggles with back pain and knee pain.
Mhm.
So we are talking about an actual disease,
Mhm.
but people are framing it as a cosmetic issue.
Mhm.
How do you feel about that?
Wow. I think people need more honest and frank doctors, right? I think that I was, again, almost 50 before I said the word fat. I could see the fat on me, not because my doctor said it, not because somebody told me, because I could see it on myself. And so what a benefit it would be to have your health practitioner to say, no, you're obese, right? Or you're fat, or you need to lose weight. But a lot of times you can't, right? Because we live in a world where people get offended. And so you do get offended. And so I can see the dilemma for a doctor. Nah, listen, this is not my loved one. I'm not going, if they don't want to hear, right, that they're obese, why say something? And so I promise, it wasn't until I met you, and you'll laugh or joke, but you would get on me about the things, or you would say, you need to do this. But because I trusted you, right, I was able to hear what you said I needed.
Weight is not the explanation for every symptom, but avoiding the subject can also harm patients. Honest medical care requires more than judgment and more than silence. It requires trust, context, and a clear conversation about risk. When the body starts whispering, that is the time to listen, not after it begins to scream. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.